Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over total contact casting. But first, if you could hit that subscribe button, it would be greatly appreciated as it does help my channel reach more people. So let's get started. So what is total contact casting? So either this is for nurses, or if you yourself have been told that you are going to have total contact casting, you will know exactly what is going to be going on, okay? So total contact casting is a special casting technique designed to heal diabetic foot ulcers by relieving pressure on prominent areas of the foot that are prone to skin breakdown and ulceration, okay? The cast is applied so that the patient can still be ambulatory, so walk around for the duration of the casting, and it's composed of fiberglass or plaster. Its purpose is to protect the ulcer, allowing the wound to heal. Okay, so there's not excess pressure on it all the time, because with diabetic foot ulcers, they're really hard to heal because a lot of times we have the ulcers because of neuropathy and not being able to feel the feet to begin with. So when a patient has the ulcer, they can't feel that it's really sore to walk on it, and they're causing more damage to it. So if we can put them in total contact casting, it allows that wound to actually heal. So how does total contact casting promote healing of diabetic foot ulcers? So it distributes weight more evenly over the entire surface of the foot rather than a few select areas. Total contact casting, it can effectively reduce pressure on most vulnerable areas of the foot where ulceration is most likely to occur. The basic principle behind total contact casting is increasing the weight-bearing area by molding the cast to the contours of the foot. The pressure will otherwise concentrate over bony prominences. So it evenly distributes the weight over a larger area, the entire plantar region of the foot. Okay, so we're distributing the weight so it's not concentrated to one area where you're getting a pressure ulcer. So indications and precautions. So total contact casting is used to treat ulcers and Charcot foot, okay? It is important that the patients have adequate blood flow, okay? So we have to make sure that we're checking the blood flow of the foot before we ever apply this, because diabetic patients, they often have diminished sensation in their feet, so it can lead to the formation of ulcers and irritation in other areas, okay? Patients should use a cane or a crutch to prevent falls and prevent full pressure on that foot. Now, if weight bearing is permitted, we just need to make sure that we're making certain modifications so that you can do so. Total contact casting may be a strain to the muscles due to the weight of the cast. Patients need to be told that they need to report any discomfort, and patients should be reminded to keep that cast dry. Okay, we can't be getting it wet. A lot of times we'll put the patient in an air boot with the total contact casting so they can actually walk. So how long does somebody normally stay in total contact casting for? They're changed out weekly, sometimes bi-weekly. It depends on several factors, such as the amount of edema or swelling in the leg, the rate of healing, practitioner preference, patient tolerance, wound drainage. Okay, so all those factors will come into play. Now, we will use total contact casting until the foot has healed, the ulcer has healed, and the patient is ready to go in orthotics or specialized footwear. Now, whenever we put somebody in total contact casting, we want to make sure that we are doing a lot of education with that patient to make sure that we are putting things in place to prevent ulceration from forming again. Because a lot of clinicians, if they put somebody in total contact casting once, and they come back with an ulceration, you will not be going back into total contact casting. It is an expensive strain on the healthcare system. And if you're not, the thought process behind it, especially in Canada, because the government is paying for this, is that if you're not going to do preventative measures to prevent another one after having this expensive treatment done, we're not going to put you in it again. Okay. Now, if this is something that's being paid for, by all means, they'll keep doing it. But prevention is key. Prevention over cure always. I always am talking about this prevention. We need to make sure that we are getting the patient in orthotics, properly fitted shoes, diabetic footwear to make sure that new ulcerations are not being formed. Get them set up with a foot care nurse to have any calluses being removed, having their feet looked at monthly. These are all things to do to prevent ulcerations, okay? But that's all I have for this video, guys. I hope you did find it helpful, and I hope to catch you in my next one. Bye for now.